live on Instagram. This is exciting. And this is Dr. Kandis Lock with Somerset Health and Wellness Center. This is my first Instagram live interview, and I'm going to go live with Dr. Jennifer in a sec here. And I'm going to try to figure out how to get her on here. So give me one sec, and we'll see if we can do this. All right, Dr. Jennifer, let's see. To join me. Let's see if it works, and then we can find out what you've been up to at Somerset throughout these last few years. Ta-da! There she is.
Hi, Dr. Kandis.
Hi. This is I'm getting tech savvy. Dun dun dun. So
it's a new day for all of us. I know.
It's a new era in live feeds and I'm trying to wrap my brain around it all. So thank you for your patience with my learning curve here.
No problem. I liked watching you try to figure it out. I'm just going to turn up my volume here. Well, we were trying to do it on Zoom, and then we were getting all this feedback. So we got to think on our feet, right?
That's right. Hey, this is how we pivot. This is how we pivot times. Exactly. So there is a purpose for this conversation, other than the fact that I love talking to you, is that we're trying to sort of have a series of get to know all the practitioners at Somerset, and you are the clinic owner, and so you're often the one doing the interviews and chatting with people and doing a lot of behind the scenes. So I thought it would be
very true
to be able for people to get to know you. I mean, obviously your patients know you and love you, but there's other people who are wanting to know the mystery behind Dr. Jenn and her therapy dog Ginger.
Ginger, as soon as she sees Kandis, she's like, "What's happening over there?" Yeah, this is fun. It's weird. You never really get a chance to talk about our personal lives or what makes us tick. It's a lot of naturopathic medicine when we're at work, so this is fun.
Yeah, it is fun. So on that note, I know that you are kind of the digestion queen of the clinic, but tell us a little bit more about your practice and the things that you're passionate about in your practice.
Mm-hmm. Yeah, I've been in practice for a while, just like you, but I have found myself definitely just gravitating towards the digestive stuff, especially for women. I think with women, particularly once we get kind of hormones into the mix and stuff, it really changes the digestive picture. But yeah, that's what I love treating. I just treat a lot of gas and bloating and diarrhea and farts and constipation and burping and all that good stuff. I don't know. I'm super passionate about it because I myself have been there with all of it and was super frustrated by not getting the help that I needed. And so I just want to be there for these women and help them get some answers.
Yeah, and it's nice to sort of have a focus with women because our voices are not heard often, and especially talking about gas and digestive noises. It's such an embarrassing topic, and societally, I think women have kind of tended to be like, I'm not supposed to have these things, and I can't talk about it, and it's a really hard topic to have. So it's great that you can kind of share in their pain. And
we laugh a lot about it. I think it's like I remember seeing a picture once of a woman sort of like farting unicorn skittles or a rainbow out of her butt. Like that is not actually what happens to female human bodies, right? They suffer all of the same things and oftentimes more with all of the hormonal issues. So I think if we can have a good laugh about it and just normalize it, then we can actually start talking about treating it properly.
Yes, and to get some relief for sure. And so on that note, you are now running some group programs. So you ran one sort of last year in the fall and into this year that was quite successful. Well, tell us about this new program that you're running.
Yeah, I started running the groups because I was so frustrated with having a wait list of patients that had to wait months, sometimes 6 months, to get in to see me. And I just kept having the same conversations with women over and over again about their digestion, about IBS, and about SIBO, which is small intestinal bacterial overgrowth. And that's really what we know now to be IBS. for most people. And so I thought, okay, well, what can I do to see more people, make it more cost effective too? Because I know it can get expensive seeing us over a long period of time. And so that's where I decided, okay, I'm going to run this as a group and a small group, so everyone gets my individual attention still, but they also benefit from supporting each other and hearing each other's stories about what is going on for them. And there's so much commonality between all of these stories, right? It is really the burps and the farts and the pain and the embarrassment and the diarrhea and the constipation and the food. Like, what do I eat? How come I can eat this sometimes and not other times? So, yeah, that's kind of what prompted me to set up the group. And the first one was 12 weeks. It was amazing. I've decided to run it a second time, but this time I've divided it into two shorter sections. So the first half is just a gut reset. It's a 6 week gut reset. It's really for anyone. You don't need to have SIBO or IBS, because I got feedback. Some people want to be part of the group, but they didn't have SIBO, and oh no. So I don't want to leave anyone out with the reset. Let's just get everybody at the same place in terms of their digestion, deal with the basic foundational elements that everybody needs to tackle. And then I'll be running the SIBO Sisterhood, the second part, again in the springtime.
And this gut reset, for those that think they may have SIBO, is a prerequisite for the SIBO Sisterhood. So that's something
Yeah.
I think we need to let people know, that if they're thinking about
True.
SIBO and they think they might have it, this is a great jumping off point. And I know from last time you ran the group that at the 6 week mark, a lot of the women were already feeling a lot better, which is why you've kind of divided out into those two
Exactly.
things.
Not everybody will have to go on to do the eradication
Mhm.
part. They might be able to stop there, or maybe they'll just want to take a pause for a little while
Yeah.
and pick up the next SIBO Sisterhood when it comes along. So, yeah, I
Mhm.
wanted to give more flexibility and options for people.
Which is great. And we were chatting, I I don't even know what day it is, but maybe Monday, about how the gut is such a key um, sort of central point, I guess, for a lot of different conditions. And so cleaning up the gut is applicable to almost any kind of state. So which is why it's so nice to sort of go through the foundational pieces um, that often we don't get to as naturopaths either. We're so busy putting out fires that sometimes we forget to, talk about different kind of foundational pieces with digestion, like, probiotics and what kinds of probiotics, and hydrochloric
Hmm.
acid challenge, and
Hmm.
water, and the gut mind
Mind,
connection, and like all that stuff.
exactly. I
Yeah.
know there's so much content. I mean, we meet every week for an hour and a half, and every week the women submit questions and we have time for Q&A and stuff, but it really, we run out of time, and it blows my mind that we spend 9 hours together. And when was the last time you got to spend 9 hours with a patient, right, in over like a 6 week period? So it's really incredible, the amount of information, and I think that's really what makes a big difference. Is they have time to absorb everything, to put into place some new things, some new tactics, see what works too. Some stuff works really well, and other things is gonna be like, no, that didn't make such a big difference. But we're
Hmm.
giving lots of opportunities and just getting everyone to follow the same steps to make sure we're not missing out on anything.
Hmm. Yeah, and I think that's key. So I'm excited for it.
Hmm.
Maybe I'll take it too.
I
Um,
know, I know. I feel like I took it along with them. I'm like, I need this gut reset every quarter as I start to sort of, slip back into bad habits. It's just a great reminder of all the things we should be doing to take care of our digestive systems.
yeah, that's
Mhm.
true. And so if people want to join, they can head on over to the Somerset site and look under group programs to
Yep, on the
find
website.
Gut Reset. And we
Hmm.
can plug some information in here after we're done chatting on the
Hmm.
chat.
Hmm.
Um, and and hopefully we'll get everybody's digestion
It's
tickety
my
boo.
goal, man. I want
Yeah.
everybody to know there's options out there. You don't need to suffer and
Yeah.
walk around with that Imodium bottle hiding in your purse anymore. It's
Right. Or
time
checking
to.
out like where are the bathrooms that I can get to before, it can be a huge quality of life issue. So,
It is. It's
yeah.
huge. Or, you don't want to sleep with your partner because you're farting all night long. Or, I mean, yeah, anyone who's listening to this will know that they're that girl with everything that we have said. And
Yeah.
there's really no need to suffer through that. Hmm.
Hmm. Yeah. There's a solution in there somewhere.
Absolutely.
Yes. So tell me, Jennifer, who's the real Jen inside? No, I'm not going to ask you very deep questions, but I do want to know just some personal information. So, are you listening to any good podcasts or reading any good books that you want to share?
Oh yeah. So I find I never have time to read, but I am actually reading The Mindful Diet right now,
Oh,
believe it or not. Yeah, it's my coach recommended it to me. I love it. It's really helping me think about my relationship with food, which is an ongoing struggle, which is part of why I'm so passionate about talking about it in group setting.
mhm.
Yeah, that's a really great book. Highly recommend it. What else? I'm listening to, I always listen to Oprah Super Soul Sunday. She's on my
Mhm.
queue. I just have her queued up whenever I have time in my car. I listen to it. Yeah, I'm a huge Oprah fan. Hmm.
Mhm. Yeah, well, fair enough. She's a force, that's for sure.
She's a boss. Yeah.
Yeah, I listen to her too. Um, and you're a clinic owner, you have children, you're running these programs and doing 8,000 things. Tell us how you keep yourself sane. Is there any small thing that you do that keeps you up and functioning every
I'm
day?
not sure I am sane most days. No, that's a really good question. Well, I try and keep everything in perspective. So, you know, most days the house is not burning down. I just try and say I'm going to do one thing at a time and really focus on what my goals are for the day. So I try and create like a little 10-15 minute window in the morning where I do at least 5 minutes of meditation, crack out my journal, and really think about what am I going to do today and be realistic about it. So that often means crossing out stuff on my to-do list. It's remarkable how little we can actually get done in a day, right? It's usually
Mhm.
like two or three things. I think I can do like 12 and then realistically not. And one of my new strategies is I actually book it on my schedule. So, like, Instagram chat with Dr. Kandis, boom, like it's actually in there for the amount of time that I think it's going to take. And then some time for water and peeing before and after to be realistic, right? So that has
Mhm.
been huge, scheduling time. I think that keeps me a little bit more sane. And in that, I schedule my workouts. I always try and do something, even if it's just 10 minutes of skipping, or these days trying to get out for a ski. I have a
Mhm.
personal trainer, which sounds very fancy, but honestly, it saves me most of the time. I don't think I would work out if I wasn't accountable to my trainer.
100%. Yes, that accountability piece is so key.
Yeah, like I
I'm
have a
making that.
team
Yeah.
just like I want, that's what I think we offer, right? We offer people that health team, and that's why I love owning a clinic. 'Cause we bring the best people to our patients, but I also need a team. So I have surrounded myself with some pretty amazing people that help keep me on track.
Yeah, and having those be part of your non-negotiables, where it's
Yep.
and that is, I mean, that is true. That's the whole, you need to fill your own cup. I mean, everybody knows that saying, but it's I think I see you living that, which is really inspiring, is you fill your own cup because you have to. Otherwise, you can't show
Hmm.
up properly for everybody else. And that's the key, is that it's really, although it's for you, it's also for them, for your kids, for your family, for your friends, for your patients, is
Totally.
to fill your own bucket so that you can be that person for everybody else too and
Hmm.
get the best
Yeah,
of
I
it.
think I think anyone who's a caregiver, which a lot of women are, even if they're not in the profession necessarily of being caregivers, we often take care of others before we take care of ourselves. And I think that's where a lot of us go wrong and find ourselves burnt out, right?
Mm-hmm.
So that's a big part of my practice that I love bringing in with my clients is stuff around mindfulness and
Yeah.
self-care and being present. And I love having those conversations. I think that's really one of the things that transforms people's lives.
Yes, I think, and it's a big part of healing in general
Yeah.
is taking time for ourselves and listening to ourselves and our bodies and what it's saying. I think that's
Hmm.
huge. That piece of it. I mean, there's the physical, but there's also the emotional, and the mental, and the spiritual that go right along with that. So that's
Hmm. Yeah,
that's
totally agree. That's why I love what we do. We get to look at
Mhm.
all of it.
We do, which is so great, and that's I think why why our clinic is so special. I mean, lots of practitioners, but I think we all really strive to hit those goals for with our patients. So
Yeah, we definitely all share that core value for sure.
Mhm.
Hmm.
Yes. And I know we both have meetings and patients to get to. So, one
Hmm.
last quick, very vital question. Tell us what's in your pantry. Any hidden gems in there?
Hidden gems. Um, what do I have in my pantry? I think I've got like pretty good stuff in there. I think the thing people will be surprised, I was laughing about this, and we got together this summer at a cottage. I always have Cool Whip in my freezer, which most people probably wouldn't expect, but I don't eat dairy and I eat mostly low FODMAP most of the time. And it's one of those things that tastes like ice cream to me and does not bother me at all. So I just love it. It brings me joy. So that's probably the most surprising thing in my pantry that people would be like, what? Everything else is like gluten-free bread, almond milk,
Mhm.
vegetables, lots of meat, fruit, veggies, all that healthy stuff.
All the traditional naturopathic
All the
goodies
boring naturopathic goodies. Yeah.
with a side of Cool Whip, which is what I'm human.
Cool Whip and dark chocolate. Yeah, that's my go-to.
Yes, and I did try it, I will say, when I was at the cottage with you, and it is delicious.
Right?
There is something very, yeah, very delicious, very delectable. I don't know what the word is, indulgent about it,
Very
which kind of feels nice because it's not,
satisfying.
yeah, yeah.
I know. I know.
It hits a few of the good sweet points for sure.
Hmm. Yeah.
Yeah.
So that's the thing I'm hiding in my pantry. Hmm.
Yeah. All right. Well, I know that we all have things to get to and things to do this afternoon, but thank you very much for taking the time to chat with me before you go about your busy
You're
day.
welcome. Thanks for taking the time to interview everyone. This is so cool. We're going to get to know
I'm
all the
okay.
doctors at Somerset a little bit better.
Yes. So you've been on my radar for a while, so I'm grateful that we finally made this happen. And
Amazing.
yes. And so anybody who wants to join Jen's group, go to the Somerset site and check it out. You will not be sorry. It's an amazing program. All right. Okay.
Awesome. Thanks, Dr. K. Talk to you later.
Goodbye.